redness of eyes. So, but last time what we found that they have presented with cough, cold, temperature. But this time I think that the incidence of temperature is also not very high. Though a few kids are presented with quite high temperature, but compared to last time, this time I think very low grade temperature, mostly presenting as gastrointestinal symptoms like vomiting, diarrhea, abdominal pain. A few children have seen presenting with just a sore throat and red eyes. So most more like an upper respiratory tract symptom, like a normal flu symptoms. But till date, we haven't found anything which can actually help to prevent them. So the basic thing what we need to know is the parents who are going out for work, I think they should be making sure that when they come into the house, they should be actually properly washing their clothes outside, or maybe make sure that they don't interact with the kids before they take a shower or change their clothes, because that's the only source of infection, what we think nowadays. So that's very important for prevention. So as far as prevention is concerned, I would say that primary prevention is more important nowadays, because of course we can prevent kids from having infection. So maintenance of ventilating hygiene is very important. And of course, we don't expect kids to wear masks at home. So there's no use of recommending masks at home, because I found few parents who are actually making the kids wear masks at home. It's not at all right, because unless they're really big kids, I don't recommend them to wear masks at home unless they go out, or unless they go around the flat or around the complex. But I think there are medication wise, I think there is nothing much to do, because though we are giving a lot of vitamins and zinc, I think that just doesn't work like that, because we cannot uh, just spike up the immunity like that. Though it's it's mostly like a placebo, I think, because I think because giving me vitamins and zinc, because that's I think only the parental reassurance. That's the only thing I would think, because though we are prescribing some vitamins and stuff, but actually, honestly speaking, there is nothing much to do with immunity. It's inherent immunity. So, but luckily, in comparison to adults, they have better immunity than the adults. So the symptomatic cases, though, are present much more this time in comparison to last time, but still we think they don't have serious symptoms this time. Maybe due to immunity, that the inherent immunity, but honestly speaking, the medicines don't do much. So my advice to the parents would be to give healthy food. Proper. The most important thing is providing healthy food with rich in protein. And number two, I would suggest to make them drink plenty of water, because of course dehydration is one of the causes of, because if they have diarrhea, vomiting, etc., and even any viral infection causes for dehydration. So I would suggest them to give plenty of water, if preferably ORS if possible. But if they don't take ORS, that's not a problem. You can give plenty of water, and of course, healthy diet. And if there are if the kids are slightly of the bigger size, like more than 10-year-old, like adolescents, I would suggest them to do some light physical exercise at home, do some respiratory exercise as well. Apart from that, there is nothing much to do. If there has temperature, give some Calpol and just bring the temperature down. But I don't regularly recommend to give Calpol, because I don't want the temperature to bring down every time, because that's the way the body fights against infection. So if the fever is really high enough, or if they have constitutional symptoms like headache, body ache, can give some Calpol. And of course, we are giving some zinc and vitamin D, and of course vitamin C, which we can give. But apart from that, I wouldn't be recommending anything at all. So basic thing is primary prevention. In case they get infected, which is quite possible, because in every family we're getting infection, nothing to panic. First of all, the most important thing is not to panic, because that's thing we start panicking and we start messing up things. So first of all, not to panic, because as I mentioned that though the kids are affected more this time, the serious infections are reasonably less. Make sure that the kid is comfortable temperature wise, eating and drinking well. And of course, there are a few red flag signs which should be considered. First of all, that if they really are diarrhea, vomiting is serious enough to cause dehydration, if the child is not eating enough, if you think the urine output is very less, not drinking, having frequent vomiting, and if they are very drowsy, lethargic, or if they present with a generalized rash with red eyes, that may be a bit premonitory symptoms for a bit for further complications. Test wise, I would recommend that every kid should get tested whenever they show symptoms, but it's not that you have to test on the day one, because any temperature at this time in this period of time, we should be considering it COVID positive. So whatever the symptoms are coming, upper respiratory tract symptoms or temperature or gastroenteritis, is COVID unless proved otherwise. So any illness in a child can be considered as COVID positive. So don't jump on to take tests on the same day, but eventually the kid should be getting tested. And of course, checking, of course, there are three things we need to check anyway, as similar to adults. Checking the oxygen saturation with pulse oximetry. Usually the pulse oximeter which we use for adults is usually okay for kids more than 3-year-olds, but of course for tiny ones it might be a bit difficult, tricky to get the pulse oximetry. But nevertheless, just keep an eye. If they show change in color, if they show that they're lethargic, if they are really drowsy, of course they should be brought up to the doctor, to see a doctor, to the hospital. So testing wise, only we can do some RT-PCR for COVID. Apart from that, no blood investigations are recommended unnecessarily, because that doesn't help anything. No HRCT at all. Even if they're coughing, according to the latest guidelines, we can give some inhalers, steroid inhalers, but depending upon the clinical scenario, you should be contacting a doctor, whoever is looking after your kid. But never go for unnecessary tests like HRCTs, chest X-rays, and of course blood tests, because they are not very helpful in kids. The only thing I would like to warn the kids, I'm not actually scaring the parents. The only thing what can happen, because the only complication which happens in kids is called MISC, or post-inflammatory syndrome, or multisystem inflammatory syndrome, which happens few days after the kids get better from this COVID infection. So that's basically they present basically with a rash, with a temperature, redness of the oral mucosa, maybe the eyes might be red as well. So these are preventative symptoms for that particular condition. So if you find that the kids, after getting improved, so say after a couple of weeks, develop this sort of symptoms, definitely they should be seeing a doctor as soon as possible. But the incidence is very less. So I would suggest not to panic, but keep an eye on the symptoms. So basically management is very simple in kids, not to panic. Just keep an eye, monitor temperature, pulse oximeter, and regularly consult with your doctor, and preferably online. Don't have to go to the clinic. You can preferably consult the doctor online. So I think that's it. I don't think I need to say anything more about kids, but if you have any questions, you can just let me know. I can ask. So Shumita, that's it for me now. I think nothing much to say about kids.
Yeah, is good. Yeah, that was a very good discussion. Is there any question, Devaruti? Can I also request everyone? Sorry, Devaruti, can I just quickly say, can I just request everyone in the team to just mute their video?
I think,
Yeah, because these are very very bad distractions. We cannot hear so many background noises.
Shumita, Dr. Shoposhachi, we've got one question. Is breathing problem a symptom for kids?
Of course, yes, because as I mentioned that this COVID virus can affect both upper respiratory tract, which includes nose and sinuses. It also involves the lungs. So breathing can definitely be a symptom. But usually, luckily, what we are seeing this time, the breathing difficulty was more prominent last time than compared to this time. But of course, it can be a symptom. So any breathing difficulty should be brought in, should be contacting a doctor. Of course, we are checking the pulse oximetry regularly at home. But any breathing difficulty, should be considered a red flag sign.
Okay, thank you very much, doctor. Any other questions on kids for Dr. Shoposhachi?
Okay, so I have one question from one of our patients. She was telling me that she was getting headache. The little child who came to me and with a headache, with a severe headache for last 2-3 days, and with Calpol and paracetamol it was controlled, but the headache, what do you think, whether this is also a COVID symptoms or it is just a headache?
Yes, COVID, I mean, definitely headache is a symptom for COVID infections. I mean, any viral infection can cause headache, so it's not only COVID. The most important thing is, of course, giving analgesia is definitely important. If it doesn't get better by paracetamol, you can try some NSAIDs like ibuprofen along with that. But again, drinking plenty of fluids is very important, because sometimes what happens is dehydration itself can precipitate a lot of headache. So apart from giving medications, I think it's important to give enough fluids. At least I would recommend for a kid around 2 to 3 years of age, at least 2.5 liter of fluid is recommended at this juncture. So giving a lot of fluids and giving paracetamol, and of course, if it doesn't help, you can go to ibuprofen as well. But yes, it's a prominent symptom of COVID. Not only kids, headache is also a very common symptom for adults as well. And of course, if it persists more than 5 or 6 days, I think that should be considered as a red flag, considering the whatever is happening nowadays. So any symptom which is serious enough, I mean, even if the temperature is very high, even the headache is very severe enough and persists more than 5 to 7 days, that should be also considered as a red flag sign.
Thank you.
Right,
Doctor.
I got something else. Rash.
Yeah.
Rash.
Yeah.
In rash.
I mean, there are two types of rash we are worried about. First of all, any infection can cause a bit of rash. It's viral rash, viral exanthem. It can happen from day one onwards. But as I mentioned, that if the child gets getting better and then having rash after a couple of weeks, that is something which is very serious, because that is a sign of post-inflammatory syndromes or PIMS or MIC, whatever we say, or Kawasaki-like syndrome, because they can cause, that can be an indication of a serious symptom. So any rash on day one is not that serious, because can be a part of the viral exanthem. But again, if the child gets better and develops rash and red eyes, that can be a premonitory symptom for these serious complications as well.
Thank you for that.
Thank you so much.
Okay,
Dr. Sudeep Basu has some questions, I think. Dr. Sudeep Basu. If Dr. Sudeep Basu can unmute. Dr. Sudeep Basu is muted.
Yep.
Dr. Sudeep Basu, need to unmute?
Yes, can you hear me?
Yes.
Thanks,
thanks, Shobhasachi. Very wonderful presentation. Now, you know that very recently there's a lots of confusion from the claim done by our favorite chief minister in Delhi that suddenly the wave 3 will come with another strain which will affect. Let's go. And that was vigorously protested by the people in Singapore, that it is the Indian strain which is causing the problem there. Now, what is your comment on that? Is there any validity in that?
I think the latest trend, which is actually infecting everybody, is nothing special for the kids because it can affect anybody. The only thing is the changing symptoms have happened, but again they are worrying about wave 3, because the only reason about that is because most of the adults are getting vaccinated. We haven't vaccinated the kids yet, so it might happen that a good number of adults are getting vaccinated, so they can escape the infection. So then the kids' affection can be more. But I think in India, I don't think that much vaccination will happen within the next few months of time. So the affection will be universal. I don't think the kids will be especially affected on wave 3, because in comparison to other countries, because in other countries, adults are quite a significant number of adults are getting vaccinated. But in India, I think it's only 3%. So the affection will be uniform, and I don't think that any wave 3 will happen. The wave symptom, wave 2 will continue, I think, for quite a long of time unless they're getting vaccinated. So nothing special for the kids. I don't think, unless unless you think that the adults are getting vaccinated and they are getting spared. So I would say that even if there is a wave 3, the entire population will be equally affected. Nothing special for the kids.
Right. So there is one more question from Mr. Mrigang Koshil. Any particular food habits that kids in the age group of 10 or 12 should maintain at this moment? And the other symptoms of adults and kids are similar.
I think nutrition wise, as I mentioned, that there is nothing much to do with immunity, isn't it? We can change the eating habit drastically, because the kids who are not used to eat anything particular, we can't just force them to eat just because to increase immunity. But still, in general, what we suggest is to give more proteins, because that can help in developing the immune system, that can strengthen the immune system. But nothing much difference happens. I would suggest to take the normal food. If possible, give them a little bit of more protein, because just pushing protein to a kids who is not used to have a lot of protein, like animal proteins or vegetables, we can't change the immunity within few days time. So let them have the normal food, but make sure that have the enough protein. The diet is quite balanced and the protein amount is reasonably good. That should be fine.
Okay. Is there any other question, Debaruti?
I can't see. One more question I think came around. Kids often have a tendency to have running noses.
Yeah.
Go out and season change. Is that a particular thing to worry about?
Well, as I mentioned last time, I mean, a few minutes back, that any viral infection can cause a rash, it can cause headache, it can cause runny nose. It's not nothing special with COVID. So even flu can cause this sort of symptoms. So these are basically upper respiratory tract symptoms for any viral infection. So nothing to worry about. If you think that the runny nose is really bothering the child, you can give some antiallergic medications that can help with them. But otherwise, nothing to panic about having runny nose. It's a very common symptom.
Okay, I think we are almost in time to start our next session. Unless there is any other questions for Dr. Shobhushaji, we can probably start with Dr. Raja Bishwash.
Okay,
Any
Dr. Shobhushaji, thank you so much. I think
Welcome.
everyone has got some sort of idea what to do with their kids at the moment. So hopefully they will again connect to you whenever they are in
Sure,
need
sure.
or any of
Sure,
the
sure, no problem.
pediatrician. Thank you so much. Thank you.
Sure.
Thank you,
Okay.
Doctor. Thank you.
Thank you.
Welcome.
Dr. Raja Vishwash, I'll share my screen so that you've got your presentation.
Good afternoon, evening. It's a very rainy afternoon, evening in UK now. It's raining very heavily outside. And it's a miserable kind of day. So it's nice to be inside today. I'm just waiting for my presentation to load up. So my name is Raja Vishwas. I'm a Kolkata, but at present I'm a consultant in Cardiff, which is in Wales. And I've been a consultant for about 16 years here now, and quite involved in the COVID management for the last 1 year. So what I was asked this morning is to talk a bit about home management of COVID. So I'll just go through a few points, and I know some of the things which I mentioned might be quite familiar to you. I do apologize for that, but I thought if there is someone who is not aware, I'll just go through the things. So can I go to the next slide, please? So I think the issue here is how bad is COVID, and there is a lot of worry about COVID everywhere in everyone's mind, that it is really, really a bad infection, and if you have it, you're likely to die. There is a lot of things on television, on newspaper and everything, and I'm not for a moment undermining any of those information, but let's take it in perspective as to how bad it is. So if you have 100 people who have COVID, 86 of them will recover with minimal symptoms. They don't have to go to hospital. They will have minimal symptoms, won't need any treatment, any investigation, and probably some of them won't even know they have had COVID. I have met many people who have had COVID without realizing it. However, of those 100 people, 14 will be needing hospitalization, and that is primarily due to a low oxygen or hypoxia. Now, of those 14 people who are going to be admitted, 2 of them will need admission into intensive care because they will need intubation and ventilation. And about 1 to 5 people of those 14 people who will need hospitalization may die. Now, how many will die depends on the study which is you're looking at, depends on the medical support which you have in that country, as well as when the patient is brought in, lots of factors. In some areas, the mortality is quoted as 0.8. In some studies, it is quoted at 2.4. In some studies, it's quoted at 5%. So it varies between countries, between when you have done it. Higher number is there if you're not able to be admitted due to hypoxia. That's what's happening in India now, that because of the high patient numbers, a lot of people are not getting the oxygen. So the mortality is higher. And it can be as high as 10% if you're not getting the oxygen when you need. So of the 14 people who will be admitted into hospital, if you cannot give them oxygen, a large part of those 14 people might die. So that is the high risk which we have. Now, high risk patients are anyone who is over 70, who are overweight or has obesity, has got any sort of heart problem, especially heart failure. Diabetes, which is pretty uncontrolled, is a very big risk factor. or any respiratory conditions like bronchitis. And if you are immunocompromised, for example, if you are taking any sort of treatment for cancer, or you're on long-term steroids, that is a definite high risk factor for you. So going on to the next slide. So usual symptoms, the common symptoms, like it has mentioned before, are cough, tiredness, fever, and loss of taste and smell. We say these are the common symptoms, but COVID has been presenting in lots of different ways. I have seen over the last 1 year, patients who are presented with almost no symptoms to people who are presented with severe shortness of breath. So if you have something which is unusual and you know your body the best person who knows your body is yourself. So if you feel you're uncomfortable, that there is something wrong, you have to be aware that it might be COVID, because at this time when there's a pandemic going on, that is most likely.
Oh, wow.
Someone's playing the very nice music, which I'm enjoying, but if it can be muted, please.
Okay, Devarati.
Yeah, I am.
Can you see who is that?
This is a background music, very nice background music, but
I have muted.
thank you.
Sorry about that.
Thank you. So just going back on the previous slide. So RT-PCR is a gold standard for diagnosis. And one thing about RT-PCR, it can be negative in up to 30% of patients which you do the RT-PCR on. So if you are unwell and if you RT-PCR comes back negative, if the symptoms are very suggestive, a repeat RT-PCR is always recommended. Often then it's negative because it is done either too early or the way it was done was not properly done. So almost 30% can be negative. So repeat the test if you are quite sure about your symptoms. The incubation period is also about 10 days. So before you have the symptoms, you can be infective and you can be shedding the virus for about 5 days before you get the symptoms. So if the first one is negative and you have been exposed because you have been come across someone who has had COVID, it's always better to repeat the test after 5 days because you might be having this positive test then. So next slide will just explain this a bit better. So this is the way usually the graph goes in kind of COVID. So 1 week before you have the symptom, the likelihood of being positive goes up slowly. Now it reaches the peak around the time or a day or two after you start having the symptoms and then start going down. It can take up to 90 days for the RT-PCR to be negative. However, after 10 to 14 days, you are no longer infective. What the RT-PCR is detecting is only RNA particles. So that's why there is no point in repeating your RT-PCR after 10 to 14 days if you're asymptomatic. If your symptoms have improved and if you're fine, there's no point in repeating the RT-PCR because your test might be positive, but you're no longer negative, no longer infective. Next slide. So what are the things which you need to keep at home if you are going to be looked after at home, you're staying at home? The things are, one is you should be having adequate amount of paracetamol or crocin, thermometer obviously, which most people have. Pulse oximeter nowadays, everyone almost has in their own houses. If they don't, I would recommend that should be something which you should try to get hold of because it is going to be quite useful. And obviously a contact number for a doctor or a hospital or somewhere whom you can get admission, which is often a very challenging thing. Next slide, please. So regarding the pulse oximeter, it's important to get a saturation done every 6 to 8 hours if you are COVID positive. When you are doing the pulse oximeter, try to remove any nail polish or varnish and when using the pulse oximeter. If you have very dark skin or you smoke quite heavily, the pulse oximeter can overestimate the amount of oxygen in your blood. So if it is showing a very high level, be a bit careful about it. And if your hands are very cold, it can underestimate. So be careful about the oxygen saturation. It is not absolutely accurate if you are not feeling very well. Now, the other area where you can sometimes use it are the earlobes, just here, which can be very useful to measure your oxygen saturation. If saturation is going down or below 94%, there needs to be an urgent medical advice or hospitalization. Don't waste time trying to stay at home if your saturation is going down. A 6-minute walk test is sometimes useful to have a functional assessment of your respiratory condition. So to do that, you measure your oxygen saturation at the baseline. You walk for about 6 minutes. Try to do it again in a very long corridor or a room where you can walk a bit so that you don't have to turn around very quickly. Walk at your own pace. There is no fast or slow pace. Just walk as you are comfortable. After you have walked, test the saturation. And if there is a 3% drop out of your saturation from the time you started, or you're unable to complete the 6 minutes walking due to breathlessness, then you should try to get some help. And if the saturation is below 94%, you should be contacting a doctor. During home management, if you are staying at home and you don't have to go into hospital, and this is, as I mentioned before, almost 86% of the patients who have COVID, monitor your pulse, temperature, and saturation every 6 to 8 hourly, and try to keep a record, try to note it down. What is it? Because that will be very useful if you need to come into hospital, as well as to see how it is fluctuating. Take paracetamol 500 milligrams or 650 milligrams 6 to 8 hourly, depending on if you have a temperature or if you have a lot of body aches or headaches. If you have a lot of cough, avoid lying on your back. If you want to sit up on your side, or it sometimes is helpful. Before you take a cough syrup, try a spoonful of honey, because that is often much better than a cough syrup. Cough syrup often has got codeine, and I'm sure Arjun is on later on, and I'm sure he'll agree with me on that. If you are very breathless, keep your windows open if possible, and avoid using fans, because if you are using fans, the virus has a chance of spreading widely. Sit upright in your chair, and sometimes if you are severely breathless, you can do proning, which is lying on your stomach. Basically, what it does is, if you're lying on your stomach, the heart does not press so much on your lungs to a slight extent, and that can relieve a bit of the breathing difficulty which you have. If you're feeling very sick and almost vomiting, you can try Domstal or domperidone, which is 10 milligrams once a day for nausea. Budesonide inhaler, which is has got some evidence regarding symptoms, is Budicort, is 800 microgram, which is about 2 puffs you have to take 4 times a day, or 4 puffs twice a day. That can be helpful. Drink plenty of fluid. Make sure you are well hydrated, which is very, very important. You can gargle with a semi-warm water. Steam inhalation is sometimes useful, but be careful, not very strong boiling water, so that you don't scald yourself. A nutritious diet. There's nothing which is you shouldn't be having, but make sure you're having a nutritious diet. And try to do a 6-minute walk at least twice a day, just to make sure that your saturation is not too bad and your physical respiratory function is good. Next slide, please. So what are the signs of worsening when you should be seeking for medical review or hospitalization? It's at a time when you have a persistent temperature, when your temperature is not going down in spite of taking paracetamol. Your saturation is going down and often reaching a level of around 94%. Don't wait for anything else. Call for help. Constant cough, which is not getting any better. In fact, it's getting worse. You're getting more and more breathless. You're feeling more and more breathless. Check your respiratory rate. Get someone else to check it, because if you are checking it yourself, you often become very anxious. See if someone else can check your respiratory rate, how many times you're breathing in a minute. If it's more than 20 per minute, then it is something to worry about. And if someone finds that you are getting more confused, or there is reduced urine output, that is often a time to get help. Or if you have someone at home who is having that, that is a time to get help. Next. Medication. There is no proven treatment for non-hospitalized patients, and in particular, things like hydroxychloroquine, azithromycin, doxycycline, vitamin C, D, zinc, favipiravir, ivermectin. Nothing has got much of evidence. Ivermectin is still under review. Oh, sorry, just go back. Ivermectin is still under review, but at the moment cannot be recommended as a treatment or as all medical treatment should be monitored by a doctor. So if there is a treatment going on, please do not do it on your own. Get a doctor to help you. Saturation is dropping below 94%. Urgent hospital admission. But in that case, if you cannot get a hospital admission because the beds are not possible, and in only that circumstances, you can start dexamethasone 6 milligram or prednisolone 30 milligrams with apixaban, which is Elquis 2.5 milligram twice daily. But I'm talking about only in a very in a situation where you cannot get into hospital and you're waiting for a bed and your oxygen saturation is dropping. But do not do this otherwise. Do not take steroids, especially if your oxygen saturation is not dropping. That is very important, because if you start steroids when the oxygen saturation is not low, it will be more harmful and the disease can get much worse. The next one. So in summary, most patients with COVID will recover with no treatment at all. So although you have to be careful, that is the bottom line. If you are careful, if you have to stay at home, take those precautions. Monitoring saturation is very important. If saturation is dropping, urgent admission into hospital is needed. Never start steroids if not hypoxic. And please, please don't start any medication without medical advice or supervision. And next slide, last slide, I think. And thank you very much. Now, if anyone wants to contact me about COVID-related medical queries, I'm very happy to be contacted. I might not be able to answer any queries straight away, but I'll try to be as helpful as I can. And that's my email there if anyone wants to contact me. Thank you.
Thank you very much, Dr. Raja Biswas. Do anyone have any questions for Dr. Biswas? Can you please send them in the chat, please?
Okay, someone has just asked me about the AC, air conditioning.
Yeah.
So Dr. Raja Biswas, air conditioning. So whether it's a ceiling fan or air conditioning, which one is preferable at this point?
I think the important thing is with a fan, there is a higher chance of viruses circulating a lot, especially if you have a lot of infection. If you, especially in Kolkata now, when it's very hot, you need the air conditioning, but not at a very high, not very cold, just to not make it very cold. But you remember, the problem with air conditioning, it dries also. It dries the mucus. So there is a higher chance of infection. So it kind of keeping that into mind, I think you have to be realistic. If you can manage just keeping perhaps the window open, whether that's a possibility. But at the same time, you have to be realistic as to how hot it can get in Kolkata as well.
Okay, so the bottom line is the ventilation. The ventilation has
Absolutely.
to be on all the time.
The ventilation is the bottom line. Good ventilation is very essential.
Yes. About the diabetes patients, it's like you have just suggested that patient can take honey. So what these patients are going to do if they are highly diabetic with their cough syrup or honey?
When you are taking the honey, it is only for a very short period if you have got a very bad cough at that time. So I'm not asking honey to be taken long term, but for a very, very, very short duration and just to relieve your symptoms. Now, for a short duration, if your blood sugar goes up slightly, that is not as bad if you are being constantly coughing and you cannot expectorate anything. Again, it's a question of how bad your diabetes is. If your diabetes is totally out of control, then you have to be careful about the amount of honey you're having. But in that case, codeine cough linctors can be an option. However, to be aware of the cough linctors, a lot of them have codeine in it. So it just dries up the secretions quite a lot.
Right, Dr. Shobhashaji, I can see you have just written me something about cutoff oxygen saturation for steroid based on recovery trial. Do you want to just explain what was that?
Went through the trial reports. It doesn't mention. It mentions that start steroids in hypoxic patients, but there was no cutoff mentioned. The only thing I could find that in some literature they mentioned about 90%. If the saturation going over 90%, then only start steroids. But in actual sense, are we doing that? I think the cutoff is some doctors are making it 94, some are 93%. So what would you suggest? Should we go according to recovery trial, or should we be more proactive and start the steroids even on 94, 93%?
In UK, it was being used on 92%.
Okay.
And 94%, I think, is the valuation which is used often based on NIH recommendations. I think if your saturation is dipping and going down and it is reaching a 94% level, I think steroids will definitely be useful. Whether it's 94, 92, or 90 at that stage, I don't think makes too much of a difference when your saturation is on the way down. I think it's a trend that is important rather than an absolute number.
Right.
I think
Dr.
Shruti Basu, Dr. Shruti Basu had some questions.
Raja, thank you for a very lucid discussion. I think in Calcutta, we face quite a few practical problems, which probably you have not seen in UK. I have been consultant with quite a few patients who started having problem with the oxygen saturation and they were symptomatic. And though I told that you take paracetamol and make sure the oxygen saturation doesn't drop below 94%, and then they started contacting many general practitioners. And suddenly we find that most of the general practitioners are extremely specialist in COVID treatment based on 1 year experience. And not necessarily they follow any guidelines. So what happens? And they actually give a full page of prescription, including 2 antibiotics and doxycycline, even meropenem, along with some steroids. It's very interesting. These patients uses oxygen cylinder every 6 hours completely and using a bigger one and suddenly going breathless after 4 days in a very moribund condition, they then looking for a bed. And that is one of the reasons why we are seeing so many deaths by the consultant. Even the best respiratory physician could not do anything. And that is a very sad situation because people are thinking that I can manage COVID at home with just oxygen and medicine from the GP. And they didn't understand that this time, this particular virulent strain is sometimes affecting the lung in such a way that deterioration just happens within 24 hours. And even with your best contacts, it is extremely difficult to get a bed in a hospital. Forget about ITU, just even a general bed, and the patients are dying here and there. Now, I do not know how to solve this problem. Very recently, 3 of my patients suffered like that. The one is still in ITU and gradually recovering. One patient has died. And I do not understand how to solve this problem because we all know that what is the evidence. We are discussing in different forums, but probably this general practitioner do not take a cue from this discussion. And unless we sort out this problem, the mortality is not going to be decreased. Even the infection rate is gradually coming down. And what is your take on that?
Sudipta, I cannot agree with you more. Number of people I have been contacted from Kolkata with prescriptions which go on to 2 pages is so you just feel that why are you having an antibiotic, zinc, vitamin C, vitamin D, you name it. It's all on the prescription, which is not required at all. You know, all the things, but this is a general. I will not only blame. Sorry to say this, I will not blame the doctors all the time because there is also a feeling from a lot of people by reading something on WhatsApp or Facebook or something that, you know, the treatment of COVID, they know everything about it. I often get asked about a lot of the medication, for example, plasma therapy and things like that, which has got no absolute evidence, but someone has read it somewhere in the WhatsApp messages that it works very well, or one of the drugs like which I have never heard of works very well. And then they start badgering the GP. And what will the poor GP then do? Because if he doesn't prescribe, he'll go to the next doctor who will prescribe. You know that very well. I think it is not only the doctor's fault. I completely admit I think a lot of the doctors are prescribing which should not be prescribed, but also the expectation. And I think that's where someone like you or someone like the other people in here who are practicing in Kolkata are very important, because people listen to you. People listen to your voice and they will listen and trust you. We can only do so much, isn't it?
I have one question, if it's possible. Like, can I ask one question? Because I have faced some practical problem. Basically, is of course doctors are trying to follow the guidelines, definitely. But what happens is sometimes if you just prescribe a Calpol and say that that's the only medication you need for your patient who is COVID positive, and the parents or the patients are panicking. So how can we get better just with Calpol? So for that, I think for reassurance, we sometimes have to give some vitamins and all those things. I know it doesn't work. Vitamin D, vitamin C, etc. doesn't work. But if you just give Calpol, I face many questions like, যে ডাক্তারবাবু খালি ক্যালপলে কি ভালো হয়ে যাবে? কোভিড হয়েছে বাচ্চা, কোভিড হয়েছে আমার, তো ক্যালপলে কি ভালো হয়ে যাবে? তাহলে কি অন্য কোনো ওষুধ দেবেন না? So sometimes doctors are bound to write them, but of course we should write something which is not harmful. Of course, writing antibiotics and stuff is will cause more harm than good. But sometimes we are bound to write vitamins and stuff, because not because that we are not following the guidelines, only because that we cannot satisfy the patients, because they are getting a lot of information from various places. তো আমার পাশের বাড়ির পেশেন্ট তো 10টা ওষুধ খাচ্ছে, আমাকে খালি আপনি ক্যালপল দিচ্ছেন। So this is the problem, isn't it? There is no uniformity in treatment. So we sometimes have to write something which we may not feel like writing, but still we have to write it.
I think what you are saying is right, but these are more of a complicated social issues which we can't solve here. And I don't think I have an answer, or you have an answer, or Sudeep Dara has an answer. This goes much deeper than that. All I can do is tell you what is the evidence for this. Now it's up to individual people to either follow the evidence or look at the overall how they want to do the practice. But I take your point. It is always very challenging to do one and expect people to trust you on that.
Yeah, that's true.
I think from the COVID first wave and COVID second wave, and there is a definite change in the trend. The COVID first wave, we saw lots of asymptomatic, and the idea was that if they don't develop the symptoms with the day 10 to 12, usually by day 14, they'll be out of danger. But this time there is a complete shift. Sometimes the patient is having more fever, 101, 102, even 103 on day 9, and they are having this respiratory problem later on. And what I have observed from my friends, patients, colleagues, and Raja will be able to vouch for that. But this time that respiratory infections or the pneumonia is happening too quickly and not giving a chance. You're starting the steroid, and then when to start the steroid, whether it is too early or whether it's too late, there's a very, very thin line. And it's very, very difficult to identify the thin line, the ideal time to start steroid. Yes, it is right. But I have seen that many times the patients are being treated with the steroid, just thinking they're going to develop a very severe hypoxia and lung damage. And they're giving a high dose of steroid. You do not believe what is the dose of steroid they're getting. And probably Arjun will come telling us later on that now what is the after effect we are getting. So what is, Raja, do you think that from the symptom point of view, the COVID-1 and COVID-2, the first wave and second wave, is completely, or I should not say completely, it's definitely a different picture altogether? What is on take on that?
Two things about it. First of all, regarding the steroids. So if you give the steroids too early, that is a virus replication phase. So if you are giving at the virus replication phase, rather than later phase when there is the cytokine storm, when there is an inflammatory process, you will make the replication worse and the infection worse. Now, with regarding your question about whether the second wave is now it's worse than the first wave, I have managed COVID from March last year, and UK had the second wave from November till March. I found that the second wave was much worse than the first wave. People were getting ill much quicker, and they were getting into ITU much quicker. So around December, January time in UK, things were as bad as it is in India now. The only difference was because the primary care system is so strong in UK, as you well know, that's why most people didn't go to the hospital. They could be treated at home. But because that is not there in India, and because this strain is very infective, so the high numbers are going into hospital, which is completely overwhelming the hospital. And because the system is not there to cope with it, you can never have enough beds anywhere in this country, any country, to and that is a absolutely idiotic ask that every patient should have a bed. You cannot. This is once in a century kind of illness. You cannot have enough beds. It is just the system is not there. But Shobhushaji, going back to one thing which you mentioned before, that you think this second wave will continue. I don't think so. I think if you look at the pandemic, all the pandemics usually with this infection, it goes up like that very quickly, which it has done, but it will come down quickly as well. So I think by like early July, you will find like in the next 2-3 weeks, the numbers are coming down because A, you have gone into a lockdown. B, people will be becoming much more. Things will stabilize, but around September, October time, you will have another third wave. You are bound to have a third wave, but there will be a gap between that, which will, I think this wave will subside by mid-July, end July, and then you will have another wave around October, November, when it gets slightly cooler. That is my perception. I may be wrong, but that is my thinking.
Okay. So even if you think that we are not getting enough vaccinated, people are not getting vaccinated, still the wave will go down.
Vaccination will increase, but because there is not enough vaccination, the third wave will happen. But because of the lockdown and everything that is going, the social distancing, the numbers will come down. But then because there is not enough vaccination, the numbers will keep going up again.
Right.
Right. I think I have got some questions from Mr. Jay Shankar. Is it necessary to keep an oxygen concentrator at home, considering the pressure in the hospitals?
If you ask me for as a thing, no. I would say certainly no, because oxygen concentrators are in short supply everywhere. So if you have to give oxygen concentrator, it should be by and two things you have to remember. If you are needing oxygen, if you are getting hypoxic, you should be going into a hospital as soon as possible, because a lot of people who are needing oxygen has to be going on to the CPAP or NIV and going into ventilation after that. So the best place for them is to go to hospital. Number two is, if you have a concentrator, it has to be monitored by a doctor and a team. So giving it at home will give you a false sense of security. And like Shudipta, I think, said before, when you deteriorate so quickly after that, because your saturation cannot be maintained, you will not have the time to go into a hospital. So going into a hospital, if your saturation is dipping, is the right thing. If you're needing oxygen, you should be going to a hospital.
So there is another question. So if there is no oxygen concentrator or oxygen cylinder at home, what a patient can do at home at that point? Is it proning, ventilation? What sort of thing they can do to manage?
The proning is one option, but yeah, if you had enough oxygen concentrators everywhere, that might be a good option to have an oxygen concentrator or oxygen cylinder at home. Do we have that? I don't think so. If you want to help in any way, proning is certainly a very good way, trying to relieve some degree of breathlessness. Number two is ventilation. But these are all stopgap measures. These are not measures which will stop you from getting hypoxic. Now, if again, going back to Jayashankar's question, if you have, if every person keeps an oxygen saturation at home, will that be enough? But if you keep it at a centralized point to be used by a lot of people, which can be used as necessary, that may be another way of looking at it. For example, I know Jayashankar lives in a multi-storied building. So if he has got one oxygen concentrator or two oxygen concentrators in a multi-storied building, which can be used by any residents who might be feeling that way as a stopgap kind of bridging thing before they go into a hospital, that might be an option.
Yeah, I mean, there should be some justification at the end of the day, whether we can stock it up or not.
Exactly.
So stocking of medicine or stocking of oxygen concentrator or oxygen cylinders is not the way that we can deal with this pandemic at this moment.
No.
Okay, there is one more question from Kollol Kumar. Does the oxygen cans help in any way?
Sorry, oxygen?
Oxygen can. There are like little cans which I can see.
Portable oxygen cans.
Oh,
Yeah,
for portable
portable
oxygen can. I think that's the same thing as I mentioned with the regarding oxygen concentrator. It's the same kind of answer. Like, for example, I've seen in a lot of places, and obviously in Calcutta, you will be familiar with it, the oxygen langar and things like that. Now, my personal view is, how is that helping? If you are not needing oxygen, you are going into a langar and having oxygen for half an hour, how is that helping your lung function or saturation or function? It's not helping you, because it should be reserved for only when your oxygen concentration is going down, not at other times.
Okay, conscious of time, I think there's one final question regarding home management of COVID. When do we know that we need to go for blood test and CT scans? Is that a necessary, or there are certain symptoms that will indicate that we need one?
CT, high resolution CT chest is reserved, should be reserved for a very specialized, should be reserved for only very limited indications. You have to remember, high resolution CT scan exposes you to a very high dose of radiation. It's not an absolutely safe thing. It is, you're exposing you to a high dose of radiation. What for? Most of the time, a chest X-ray is more than enough to diagnose or treat COVID. If you need a high resolution CT scan, you are thinking that there's a blood clot in the lungs, or you have got quite severe infiltrates into the lung, which is causing a saturation to drop. In both conditions, you should be in a hospital. And Sudipta, I think, had a question.
Quite a few patients are getting better discharged from the hospital, then they are dying very abruptly. Okay, so it doesn't still fall in the domain of the long COVID syndrome, because it is happening within the next 1 week, 2 weeks. And this is just happening very frequently. Almost we are hearing it every day. Have you seen this type of phenomenon there, or you think that is very typical of the second wave and in India?
I think it is. In fact, I have lost about 2 of my friends around my age with this kind of thing, who went home recovering from COVID and suddenly died. I personally think that because, as you know, COVID is a very prothrombotic kind of condition, which causes clots everywhere. I think there is a high incidence of PEs happening once they go home, because when they're in hospital, they are having the Clexane injection. Once they are going home, they are not having any sort of anticoagulation. But at the moment, the recommendation for anticoagulation after discharge is very not very clear. There is some study going on when they are doing a randomized controlled trial of giving anticoagulation following discharge and not giving the anticoagulation, but the trial results are still waited. My personal view is that if someone has got oxygen for more than 24-48 hours in the hospital, and if they have been bedbound and staying for more than 1 week, they should go for some sort of anticoagulation like apixaban 2.5 milligram BD for at least 4 weeks after discharge. However, at the moment, the evidence for that is not very good. But there are some studies and some recommendations, especially from National Institute of Health, who are recommending that you should go for anticoagulation following discharge for 4 weeks. And the British Thoracic Society also has come out with a guideline which says that if you are at a high risk, you should be on anticoagulation for 4 weeks after discharge. So those are the kind of recommendations I would really go for.
I think one problem with what's happening, sorry to interrupt, one problem is happening, we are more focusing on HRCTs in India. I think if you want to diagnose a PE, we're going for a CTPA, isn't it? And that's not happening regularly. So if you have a CTPA before discharge, that will be more reassuring than having a CT scoring, because CT scoring itself hasn't got any value, isn't it?
No.
So it doesn't change the prognosis or anything.
Okay, I guess we are almost on time. So, unless anyone have any other question, and if you do have questions later on, I'm just pinging Dr. Raja Vishwa's email ID on the chat. So, please feel free to send him a note if you've got any further questions. And I think it's good to start Dr. Shruti Bashu's session now on pregnant women and lactating mothers. Dr. Bashu, are you okay to take over?
Yes, it's fine. Thank you. I don't have any slides to do. I just talk a little bit about pregnant women and the lactating women. And the first thing that pregnant women are not at higher risk of getting the infection. I think the chance of infection like any patients, okay? But it is true because pregnancy is immunocompromised situations. So if they get infected, sometimes the severity of the symptoms may be more. Now, if a patient who is pregnant and get infected, we exactly treat the same way. And that means that apart from the mother, we ask about the temperature, saturations, the calpol, etc. We also ask them to check the baby's movement. And usually it's called count to 10. And it originated from Cardiff as well. So in the morning, 1 hour, in the afternoon, 1 hour, in the night, 1 hour. So 3 hours, they count the movement and we multiply it by 4. So if it is more than 10 in 12 hours, that is reassuring. And the most of the time, the patient's count is around 30, 40. One thing is that the COVID doesn't increase the chance of miscarriage, and COVID per se doesn't increase chance of congenital anomaly. The COVID not necessarily will increase chance of preterm delivery, but for the symptoms, if it is a high fever with some other symptoms, that might initiate the problem with the preterm delivery. So whenever the patient is pregnant and asks for the advice, we ask them to get isolated and to get obviously the nutritious food from somebody who is around but not infected, and to do the routine check with the saturation with the pulse oximeter. And if the pulse oximeter is less than 94, they should get in touch with the hospital to organize for the admissions. Now, there's one good test, which is 6-minute walk test, but sometimes it's difficult for the pregnant, especially advanced pregnant women to do because pregnancy itself is very tiring. So they sometimes find it difficult to do 6 minutes walk test. Now, apart from that, they're already taking some iron, calcium, vitamin D anyway. We do not like to really give any antibiotics unless there's a strong evidence that getting some secondary infection, which is usually not the case. When the patient goes to the hospitals, many hospitals, unfortunately, Calcutta refuses, or at least refuses the first time, to accept the COVID-infected pregnant women, which is very unfortunate, I believe. But this time, this attitude has changed. So in the first one, we have seen the patient, especially in the government hospital, has been referred from pillar to post to find out a hospital which is sympathetic enough to take these COVID pregnant patients. But nowadays, I think they have got these guidelines. And so most of the hospitals which used to accept the pregnant women, even though they are infected, they're accepting them. And the doctor is quite happy to help them to monitor the pregnancy, to see their conditions, to discuss with the respiratory physicians, to give the multidisciplinary approach, and if necessary, help in delivery. COVID per se is not the indication of doing cesarean sections, but no doubt about that, if they get delivered, the situation is much more better to at least manage. Because pregnancy itself is such a condition, you can understand, you cannot ask the patient to be on the prone conditions. And also with these BiPAP, all the other high flow oxygen, sometimes the patient cannot lie down in a comfortable positions as well to get those things in the right proportions. So if the time has come for the delivery, and sometimes we do the delivery, no doubt about that, after discussion with the patient. The second thing is that obviously at that time you have to make sure they're not developing any coagulopathy or some other problem. The advantage is that from mild to moderate patients, many times we do the operation under spinal, should not necessarily report extra risk to the anesthetist, but obviously everybody have to use the full-blown PPE and take the extra care. And in case the patient has got symptoms, but still not yet diagnosed, and they need delivering, then obviously you always treat them at COVID positive. Because as Raja told, 30% cases still come back as negative, which is a false negative. So you treat them as COVID positive patients and do whatever is necessary. Now, after the delivery, that when the question comes of the breastfeeding, they can do the breastfeeding, and they can use the face masks. Most of the times what we feel comfortable by expressing the milk and giving to the babies for the nutrition. Most of the modern hospitals nowadays have left few neonatal beds for observing these babies who has delivered from the COVID mother, and they just observe the signs and symptoms for any unusual things. And then whenever the mother is out of danger, and then obviously they can give the baby to the mother. The rooming in is possible, but you have to take the extra care so that the mother doesn't affect the baby straight away. The second thing is that the vertical transmission of the pregnancy to the baby, initially that was a big no-no, that it cannot happen. But few cases we have found that a virus has been found or antigen has been found isolated from the placenta and amniotic fluid. So it is a very, very, very low cases. So there is a possibility vertical transmission, but so far it has not proved that too much bad thing for the baby. So that is the thing for the pregnant women and the lactating mother. For the vaccinations, I think that though there is no evidence on the Covishield or Covaxin, the only evidence from mRNA vaccine and the study which accidentally included the pregnant women, not necessarily intentionally, they included the pregnant women in the study, they found that it gives good protections. Initially, we got the recommendation from the ICMR or FOXC not to use vaccine for the pregnant women, but very recently that guideline has changed. Now they have told that we can use that vaccine for our pregnant women, but you have to understand whatever the evidence is on the mRNA virus, which is not yet available in India. Personally, I like them to get vaccinated because out of the vaccinations, the disadvantage and the advantage outweigh the risk anyway. The lactating mother also can get vaccinated, so that is not the issue here. So for the pregnant women and for the lactating mother, we do not do anything very different. We just treat them as normal as possible, like any COVID patients. But obviously, if it is a very severe COVID, sometimes it's very difficult to manage.
Okay, that was a brilliant presentation, Dr. Shudip Basu. Do we have any questions from the audience?
Okay, so I got one question in my personal chat about the vaccinating of the pregnant women or the lactating mothers. What they can do with the vaccinations? Are they going to proceed with any sort of vaccine, or there is only one particular type of vaccine they can go for?
I don't think in the future mRNA vaccine will be available in India. So I think whatever we will have in hand, we should vaccinate them. And that is the recommendation we have got from India government.
All right. Is there any other questions? Okay, so there is a question from Mr. Kollal Kumar Ghosh. The vaccination for general people of second dose is constantly moving from 6 weeks to 12 weeks, now 8 weeks. So what is the guideline on that?
Is this a question to me or to Raja?
Yeah, I think anyone can answer this, because I think this is the problem in everywhere. Even in UK also this has happened. So it was first when we started with mRNA vaccines, It was
I think,
straight after
I
3
think-
weeks, the second dose.
See, I'll answer these questions.
Hmm.
So when it was told that we can take Covishield within 4 weeks,
Hmm.
and we are the frontline health worker, we get the vaccine,
Hmm.
then we are very elated that yes, we are protected. And we had this misfortune of believing that we are protected. And the initial joy and elation now is gone down the drain, because very recently, every week, we are getting doctors who are dying who has taken these 2 vaccines. Now, the problem is that, as you can understand, the scarcity of the vaccine in India is a significant problem, and which is definitely is not going to be sorted out in near future. So every time UK announces that these 2 vaccines can be gapped 6 to 8 weeks, our ministry increased by another 4 weeks. And it perfectly works for them, because then you get 3 to 4 months to replace the whatever the lack of vaccine you have done already. So every time Raja and his big group from the 10 Downing Street announces, and now you have to get 2 doses of vaccine in 8 weeks or 12 weeks, it directly goes to our ministry and they increase by another 4 to 6 weeks. Now, whether it works or not and how much is going to be protected, yet to see. Okay, there's no doubt about that. But probably this 4 weeks gap is not the ideal one. In fact, tomorrow, by the insistence of my colleagues, I'm going to do anti-spike antibody. Now that might not necessarily help, because that will only help the IgG antibody, but will not tell the T-cell based immunity. But the reason why you are doing it, that in case it comes down very, very low, we might think about getting another vaccine like Covaxin or something later on. The biggest problem with that if you go through the same app, you'll not be allowed, even you can pay, you'll not be allowed to get another dose of vaccines. So it is a huge problem. We do not know how we are going to sort it out, but at the moment, the guidelines what the Indian government has come out is 8 to 12 weeks. That means 2 to 3 months, they might increase it again.
Shripda, if I can just mention something.
Yes.
I think the evidence at the moment, and with all the studies, is that if you delay the vaccine to 2 doses of vaccine up to 12 weeks, there is a good immune response. Now, that is the evidence, but the Indian government has reduced it to 16 weeks, where there is no evidence. So there is no evidence to say it should be increased to 4 months. The only reason which it has been done is exactly like what you say, availability of vaccine. It is not because it is medically or scientifically the right thing to do. There are not enough vaccines, so you use it across a wider population. Things to remember, 2 things. One is that even if you have 1 dose of the vaccine, you have about 60% protection. If you have 2 doses, it obviously increases to nearly 90%. So much more effective. Now, if you have 60% protection, and if you can reduce the vaccine virus spread in a population, you are more likely to control the pandemic. However, how effective it will be after 16 weeks, no one knows. So I think there is a lot of things which are being done because of non-availability of vaccine rather than using proper science and reasoning behind it.
I think there's another question that has come through, and it's my question as well. We've often seen cases where people are getting infected after the double dose of vaccine. So how much of protection are we really getting after 2 doses, and what's the probability of getting infected after 2 doses?
Do you want me to answer that?
Anyone who can take this up.
Then I'll add something. You carry on first, then I'll add something.
The thing to remember with getting the infection, none of the vaccines are 100%, none of them. So even if you have 2 doses of vaccine, it is still about 88 to 92%. So you still have a theoretical, you have a risk of getting the infection. And that's why the recommendation is, even if you have had the vaccine, if there is a very wide pool of virus floating around, then you should take the mask, social distancing, everything as a precaution. As the pool goes down, as the number of viruses floating in the community goes down, your chances of not getting the infection also goes down because you have a high level of protection. So that is the reasoning behind it. But, most people who have the vaccine, and the evidence is, and I think this has been proved by all the studies, once you have the 2 doses, the infection and the death rate has gone down in UK considerably. In January, I had a ward, 5 wards full of patients. At the moment, I don't even have a single patient with COVID in the hospital. So that is the difference it has created.
Yeah, I think that
I think it is very interesting, Raja, how the perception changes of the human being. I can remember a few years back when I traveled in Japan, and I used to see the people are wearing masks in the train. Then I used to think these are crazy people. Now nowadays, if somebody I see that without the mask, I think they are crazy people. Now, you have observed one thing, at least I have observed my colleagues, the doctors are dying from these COVID infection after 2 doses of vaccine. Very, very few intensivists and very few respiratory physicians. But these respiratory physicians are looking after 60 to 70 patients per day. They are roaming around in the ITU with a full of very, very sick patients who are on ECMO. But very interesting, they are not getting very sick or they are not dying. And I'm not telling that we want that, we want them. So it shows that whether you are vaccinated or not, they never let their guard down. But you will see most of the time it is happening with the gynecologist, the general practitioners, pathologist, etc., because they think, oh, we are vaccinated. We are not dealing with the COVID patients. So probably we can see the patients in the clinic with their guard down. So whether you get vaccinated or not, even you get the 2 vaccination, please use mask. Because the PPE you do not need in all surroundings. In fact, the myth about the PPE, nowadays we use less PPE, but the mask, if it is properly owned, it is actually going to cut down the infections and the mortality and severe infection. I hope that Raja will agree with me.
Right. Can I also add something with the mask, wearing of mask? I have seen some patients, they are wearing the continuously the same mask every day. So how can they, how can they think that they are protected from any sort of virus wearing the same mask? Means, is there any guideline that you have to change your mask every day or after a few hours, like after 4 hours, you just change one mask, especially those medical masks or the cloth mask, the fabric one, which I think means, from my personal view, that is not very safe in this infection time. So how can you advise?
Raja, for you.
From my understanding, cloth mask is more like a filtration thing. It doesn't really do anything much. If you are in an area where there is a high virus load, especially in a hospital, a 3-layer mask or N95 mask is the only one which will give you protection. Also, the fact is, if you are using a cloth mask and things, it will give you a lot of satisfaction that you are wearing something, especially outside when you are in the public area. But if there is a high virus load, it is not going to protect you at all. So if you're going to use something, use a proper mask, which is a 3-layer mask or an N95 mask. And one thing Sudipta mentioned, which is very interesting, is about respiratory physicians and how the death rate. And also the other thing is, some procedures are very high risk. For example, Arjun, the things which he does, it's very high risk. ENT surgeons, orthopedic surgeons, they are in a very, very high risk profession because of the spread of the virus during the procedures. So I think that also is a very, very significant risk factor as to what you are doing as a doctor.
Okay, can I also mention something about the toothbrush, towels, these personal belongings? How are they going to look after this toothbrush, especially from the dental science? I have seen some guidelines about this toothbrush use that those who are COVID affected, they should change their toothbrush immediately after few days, means after 17 days or 14 days, whatever the guideline says.
Can I answer it?
Yes, yes, sir. Yes, sir. Please.
The toothbrush used by COVID patients should be thrown away. There's just a very clear guideline about that. And I mean, there's one thing for sure: people don't really share toothbrushes, so that's good. And the toothbrushes used should be thrown away straight away. The towels should be sterilized or washed in soap water, cleaned, and that will do it.
So is there any sort of degrees they should maintain when they are washing in the washing machine, like 60 degree or 90 degree towards the fabrics?
In India, we don't have hot water washing machine. You just the soap is one of the biggest killer. I mean,
Okay.
the one thing that kills COVID is the soap. Use liberally soap and wash them with the water. Keep them soaked overnight if you want to, and just wash it next day. It's very easy to kill a COVID virus if you take a good bath with soap. If you wash your hands with soap, if you use detergents to clean your garments, that usually get rid of COVID.
Okay, there is one more question from Mr. Devashish Rai. Which one of this Covishield and Covaxin is better? Please, can you explain which one is better? Yeah, I think this is a question from the last few days.
It depends on which one is available. Now,
yeah.
Also
Take your way.
It depends on Covaxin data is not yet been published, the stage 3 study, but I think it is due to be published very, very soon. So once we get that result, so it will be obviously much more useful. Covishield, I think, has got a robust data. Also, there is some risk about intracerebral clotting and the side effect. Although very minuscule, there is a risk, especially in the younger age group. But it is very difficult to compare because on one hand, we have very robust data on Covishield, but we don't have the data on Covaxin yet.
Get whatever vaccine come in your way. Grab them with your both hands and just get it.
Absolutely.
I mean, we are short of vaccine. Beggars can't be choosers.
No, no, I think it is better to just get some sort of protection at the moment.
Absolutely.
So rather than choosing.
So
there is,
sorry,
Devaruti, can I just take over?
Yeah,
there is a question about what is the probability of the reinfection if a patient is already a COVID positive patient for few weeks. So is there any probability of reinfection from Shomoroy?
Somebody else answer it, or should I answer it?
Reinfection.
Yeah, I think that's the right person.
So if you are talking about reinfection, if you after vaccination or after infection?
No, suppose someone is okay, so both ways. So someone is COVID positive and has got vaccinated double dose, and is there any chances of reinfection? Or in between these two doses, someone has got COVID, is there any chance of reinfecting again?
I haven't seen anyone who has been vaccinated who has got infection, but I have seen a few patients who has got COVID themselves and has been readmitted with another COVID infection. But that is mainly because they have got symptoms, not because their RT-PCR has been positive. The question is whether they get reinfected or whether they have got some other infection and just the RT-PCR is positive because they are shedding the RNA virus. No one can be sure of. But they are being treated as a positive if they have symptoms, the PCR is positive. But it's not very clear yet.
Okay, there is one more simple question about immunity level in one's body. Can I just ask Devaruti to just confirm with Tapun Kumar? I have a simple question regarding immunity level in one's body. Is it after the vaccinations or after the COVID positive case?
Am I audible?
Yes, you are. Please go on.
Very recently, I'm confused about one news. So far, I knew that the immunization level of one's body, if that is higher, then that will give a safeguard against the infection from the COVID-19. But very recently, one renowned doctor in India, I just like to name his name, according to his study, he's saying that when the virus enters in our body, it enables the cytokines which can fight with the virus, which is inside our body already, and the flowing out of those cytokines will make us more sick and make all the troubles in lungs and every organ of our body. Now, my question, whenever I go for vaccination, so that gives me immunization. So far, I understand. So if the immunization inside my body gets enhanced, and if that increase the flow of cytokines, which welcomes the problem of various level, then I'm confused actually. The vaccine, it enhances my immunization level, which will enhance my cytokines, flow of cytokines to fight the virus, and that causes a lot of problems. So what is the use of vaccination then?
Right, it's a very good question. Anyone? It's a very good question.
The
Yeah,
way
go on.
you look at a vaccine is not on an individual level. You need a herd immunity, and herd immunity is not possible without a vaccine. So you need to vaccinate a portion of the general population to stop them from transmitting virus from one to other. So there is two ways to do that. One is lock everyone at home, and in a country like India, it will cause devastation. It will cause hunger, it will cause deaths, it will cause political unrest, social unrest. And second is you distance between two people so that they don't transmit the virus. You make them wear masks, and they wash their hands frequently so don't transmit the virus from one to another. And the third and most effective and the best way to do it is vaccinate a substantial number of the population. So I think not getting vaccinated is not an option to us. Obviously, it is given to willing individuals. You may not have the vaccination if you don't want to, but I have got a very simple joke to tell you that most of the healthcare workers are already vaccinated, including the nurses and the technicians. So if something happens to us, you're already doomed. So better take the vaccine. So most of the doctors and the nurses and the healthcare workers perish. I mean, what's the point? I mean, most of us got vaccinated. So that's the best way.
It's my
Embrace.
gentle reminder, sir. It's my gentle reminder, sir, that I have already I have taken both the vaccines.
You did
That's
the right
not
thing,
the
sir.
question. My question
You
is on
did
the
the right
medical
thing, sir.
science. If that
So
vaccine improves the, that is my point. Medical science, what they say, if the vaccines improves my immunity system, and if that enables to increase the cytokines inside my body, and if that causes a problem to fight with the COVID-19 virus, then what is the impact of these things?
Can I
Raja, you
answer
want to
this one?
that?
I have taken both the vaccines.
Yeah, go ahead.
Okay. So if I can answer that one, so there are two types of immunity. One is B cell immunity, one is T cell immunity. So what the vaccine does, it produces antibodies initially, and in the long term they stimulate the T cell immunity. And the cytokine storm is basically dependent upon the innate immunity of your body. So anybody can have the cytokine storm. So we cannot actually predict that who's going to have cytokine storm and who's going to have a high cytokine, because high cytokine sometimes very helpful. Only when it's become storm, it causes problem with the other systems of the body. The vaccine as such doesn't cause increase in cytokine because it's increases the antibody level. So in a way, it fights against the virus and helps the body to protect against the virus.
Okay.
Of course, it helps in T cell immunity, but it's a very long-term process. But that doesn't cause the cytokine storm. It is basically the innate immunity of the body which causes the increase in cytokine. And sometimes, most of the time, it's helpful, but sometimes it can, in a storm, that can be causing problems. So we cannot predict that whether you're vaccinated or not. We cannot predict the cytokine storm at all.
I got it. I got it.
Okay, I think
Thank you very much.
we are running a bit late now. One last question. I think this one is a very popular one. People do ask, like, how long after getting the infection one should get a vaccine, and what's the duration of that time?
I think the current recommendation is 3 months. I think the government of India has said that you can get vaccinated after 90 days after having infection.
In UK, it is after infection, you should have it after 28 days. I don't know
It
about
was
India.
4 to 8 weeks.
Yeah,
It was 4 to 8 weeks. It's been changed to 3 months just
yeah.
now, at the same time as they changed the
Yeah,
vaccination.
I think
Yeah,
that's because of the not evidence, but
not
availability of vaccine.
availability of
Yeah.
vaccine.
The evidence is 28 days.
Okay,
Okay.
I think we can move to the last, but not at all the least best topic around black fungus. I guess if you've got more questions, then we can provide you an email ID and phone number to for further questions and answers. But let's start the sessions on black fungus with Dr. Ujjum Dashgupta. Is that all right, Dr. Dashgupta?
Yeah, sure. Sorry, I didn't have any time to prepare a PowerPoint because I got the news really late. I will just try to simply make you understand. Black fungus is a misnomer. Actually, it's not black. Uh, People call it black because of the black esture or the covering that causes the black fungus. And we are not unknown to the black fungus. India is a host of black funguses. We have seen mucor for m numpty of days. I mean, there are reported cases from Iran and other places, but we have seen mucors before. It's called mucormycosis. It's a very atypical fungus. And guess what? It lives in our nose anyway. In our nose, there are like 500 different types of pathogens, organisms that live in our nose, which we call, and they do no harm. And one of them is mucor. And there are a lot of other, and it also is present in like manures, compost, soil, cow dung, everywhere. It is there. Uh, Now we are seeing a resurgence of mucormycosis after the COVID. Say, I will tell you frankly, I have seen 2 mucors in my life, and I have seen 4 mucors in my life, two in whole of my life, and 2 in the last week. So something is happening with the COVID, which is making the mucor come back. And I'm sure Raja will agree with me that it's just not the mucor, it's all type of atypical infections are coming back. Atypical means the organism, the viruses, the fungus, which usually doesn't cause us any harm, are coming back to cause severe infection. And they are candida, there is aspergillus, there are different groups of fungus, cytomegalovirus, there is virus. So all of them can, after a COVID infection, is coming back to haunt us. The mucor is currently epidemic in 8 states in India, and suddenly in West Bengal we have started seeing cases. So nothing to panic about it. We have like 4 confirmed cases. I had one, and I didn't have time to confirm it. The patient died. Uh, so what makes the mucor come back? The expert, the mucorologists are telling us that it is usually the uncontrolled diabetics. So as we discussed already in there, that the diabetes is something is neglected by people generally, especially in COVID situation. And people with a blood sugar of 300, 500, 800 are walking around. And when they get a COVID infection, the pathogenic mucor which was sitting in the nose suddenly, because using the lowering of the host immunity, the body immunity start attacking things. So it starts from the nose and it goes into the sinuses. Then sometimes it enters the eyes and destroys the eyes, and sometimes it enters the brain. Now, the worrying thing is it happens in hours. You see in the morning, and by evening or the next day, it has reached the brain. It can also affect the gastrointestinal tract. Sometimes it can affect the skin, but mostly it is the nose and the sinuses. So time is the essence. And there is a drug which is called amphotericin B, which is a toxic drug, and it's not very available because it's already gone out of shelf. But that's like that. Like for COVID, there is a lot of controversies which drug to use, whether this will work or not. For mucor, there is no controversy. There is a straightforward drug called amphotericin B, which will work. So as soon as we can start this patient on amphotericin B, the better it is. Is that the only thing that can be given? No, there needs to be some surgical. All the rotting flesh or the masses, the bones needs to be removed. Otherwise, it's not going to work. So it doesn't uh, hear nice. It doesn't look nice as well. But these are life saving. What else can be done? If somebody who will suspect that he has got mucor, somebody who had COVID, number one, hum, somebody who had COVID and was diabetic, number two, somebody who had COVID and diabetic and probably was put on steroids. Now, we already discussed in this forum that there is a very specific guideline about steroids not to be given without hypoxia and for a very specific dose for a specific number of days. Now, in India, the situation has gone out of the medical hand. When a 3 times ambassador of India dies in a Gurgaon hospital car park with a lack of oxygen, then we don't have it in our hands. So people have jumped in and the civil society has moved in, like you guys as well. And there is WhatsApp prescription going around, and there is oxygen lungers being opened in gurdwaras and temples. So when you have such an unregulated response to such a massive calamity, there are some mistakes is bound to happen, and one of them is steroids. I have got an organization called West Bengal Doctors Forum, and it's 150 doctors. We give a telephone consultation to home treating patient with mild and moderate COVID. We are doing it for 26th of last month. We have served around 30,000 patients so far. And we, time and time again, we have seen them starting on dexamethasone from day one. And we had to stop it, nothing doing. But obviously, there are thousands which is missing. So unregulated steroid, unregulated diabetes, and a history of COVID is a rich mixture of mucor, these atypical funguses coming in and attacking us. So what will you do if you do suspect it? I mean, obviously, you will have a nasal symptom first. So you will have a badly blocked nose. You will have pain. You may have a bad smell coming out of your nose. You may have a brown or a black discharge coming out of your nose. You may have a problem opening your eyes or closing your eyes. You may have a swelling in your cheek. You may have suddenly one of the tooth starts moving. If you have any of these symptoms, please visit your local ENT doctor immediately. All the ENT doctors possess something called an endoscope. It looks like one of these knitting needles, small in size. They shine a light through it and they have a look, and they can tell you, they can tell you in a very early stage whether it's mucor or not, or at least raise the possibility so that the tests can be done and it can be determined and the treatment can be started. So yes, means are there in even in distant villages, even in districts. It is there. It is needed for people to be aware and go to this, visit the doctors at the slightest if they uh, have any suspicion that they may be contracting mucor. It's kind of getting a panic. I'm getting phone calls after phone calls throughout the day, and even from the phone calls I can tell them that it is not a mucor, but people have panicked out, and there is something, a tale of a white fungus after the black fungus. Please don't get scared. In West Bengal, it's still a very manageable situation. But if any of you or have these symptoms, please visit the ENT doctors as quickly as possible. So that's all I have to say. It is this is not a good disease. This is a nasty disease. It's got a very high mortality, but high suspicion is needed, and treatment needs to be started at a very beginning. And what are the warning things? Warning thing is you had COVID, had diabetes, and uncontrolled steroid. All this tell about the ACs and the dirty humidified oxygen, industrial oxygen, and dirty mask. are probably not true. Yesterday we had a session where we had one of the leading mucorologists, Dr. Ornalok from GE. He is sampling all these humidifiers and everything where the patients were, and till now he hasn't found any. What he has found that 66% of them were uncontrolled diabetic, and more or less 80 to 90% of them had uh, un, uh, unregulated steroid, more days, more dose. So that's probably the culprit. His paper is coming up next week. I'm looking forward to it, and that's it really.
Yes, is there any question? Has this function?
Can
Okay.
I ask,
Yes, go on, doctor. Yes, doctor.
can I ask one question, sir? Actually, I read a
Sure.
literature yesterday about giving increased amount, giving zinc and it relations to the mucormycosis. They said that the mucor actually grows rapidly in presence of excess of zinc because that's what they use for growing.
Actually, there is a relationship with ferritin. People with hemophilia where excess ferritin already were, it's known, and in COVID situation there is also, you measure the ferritin level. With a higher ferritin level, there is a higher increases chance of mucormycosis. Till now, there is no evidence regarding zinc. And I know we know that the zincs are getting widespread prescribed and widespread consumed. Um, we tell, like you, we also tell them that there is no point in consuming this excess zinc. It's not going to save you from it there. But pinpointing zinc for mucor is probably too early. We don't know. Till now, there is three telltale markers which are coming up again and again. Number one is post-COVID. Number two is uncontrolled diabetic. Number three is unregulated steroid use. Like I'm sure Raja will agree that steroid is a audited drug. You need to put it into paper how long you are using the or tocilizumab. The same thing. Here it is like from day one, people have started using various doses of steroids, and we are not surprised that we are seeing what we are seeing.
Arjun, if I can ask you something, I
Sure.
agree with you about the steroid, because I wouldn't start someone steroid who has got diabetes without managing the insulin first or increasing the insulin.
Absolutely.
That's a separate discussion altogether. I read something in the newspaper, either the health minister or someone has said recently, I think it's the AIMS director, that the headache during COVID can be caused by mucormycosis. Now, headache after COVID, the post-COVID period, may be due caused by mucormycosis. Now, that is a very alarming statement, because we all know in the long COVID symptom, one of the commonest symptom is headache. You get it as a part of dehydration. You get it so much, and it's a non-specific symptom. Like, how can you say headache can be mucormycosis? It can be, but it's such a rare symptom.
Our director of AIMS currently, Dr. Guleria, he spends most of the time in TVs and frequently embarrasses us from time to time. He already had made a fantastic statement about CT scan, about 300 X-rays, and he has done. This is not his first gaffe. It's going on, and he is famous for producing absolutely non-scientific, the
Exactly.
rubbish protocols. The AIMS protocols are mostly rubbish.
I've seen them. Yeah.
If you tell it to the guy from AIMS, they will fight with you probably. So that how can you say that ivermectin doesn't work, because
Yeah.
it's given from AIMS. So basically, less we comment about his statement is later. Yes, headache. If a person has developed a headache like 3 to 4 weeks after 2 or 3 weeks after the COVID, and he probably will have a scan, and if there is a mucor or any other thing, it will be diagnosed. But suspecting mucor just for a headache is plain rubbish. Most mucors will probably have headache, but all headaches are not mucor. Let's put it this way.
And it just will cause a lot of alarm. I think there is another question. Sorry.
Absolutely. Yeah. Did we have mucormycosis prior to COVID? What are the chances one might get it? Yes, we had mucormycosis. I have seen two. I'm doing what I'm doing for last 25 years. I have seen two. So that's rare. It's a dangerous disease. There are other very aggressive fungal diseases like aggressive aspergillosis, uh, invasive candidiasis. I have seen them like hundreds of those, but mucor is very rare. If you have a mucor, you probably will get a phone call in the middle of the night by the pathologist or whoever microbiologist that, boss, we have got a mucor, and you will start ringing up people, getting the patient in next day. Yes, India is a mucor capital. It's in the first wave, we already were hearing about mucor, mostly from Maharashtra and Gujarat and Rajasthan. And we were discussing among ourselves that why is that we are not getting it in Bengal? I think the answer is unregulated steroid. That's probably the answer. But this time it has hit us hard, and it has reached Bengal as well, though in a very before COVID, whenever the mucor got published, it was an Indian paper. It was always in India.
Any other questions?
I've got one question to all the senior consultants. What is your opinion about use of monoclonal antibodies, which is coming up now, isn't it? So, is there anybody of you have an idea whether it's effective or whether it's going to come to the market very soon for COVID treatment?
It is going to be released next week in India. So the limiting factor will be the cost. It is very expensive, about 1 lakh rupees per vial. There has been no random control trial on the monoclonal antibody, but it is in the NIH guideline. And if what they are saying is true, that it stops hospitalization, this will be certainly a game changer in lots of ways. However, I think the price will be a limiting factor. Each dose, I think, is around 50,000 rupees, because so that it is very expensive at the moment.
One observations, I'm sure that Arjun, Raja, Sobhusaji will agree, that even in the doctors community, that WhatsApp university, the people blindly forward whatever they get, hold on it. That is very unfortunate, because very recently we got a message that all the masks should be washed. And if we wash the mask regularly, then you will not get mucormycosis. The problem that if you wash your mask regularly, you will get COVID and die before you get mucormycosis. So I do not understand that my colleagues who are very experienced, have worked abroad, has got MD, MRCP, FRCs, why they forward these messages. So if it can happen in the medical community, you can understand what goes on Facebook. In fact, you get enlightened every day. And পিছিয়ে পড়তে হয়, তো তারা তো ডিডি মার থেকে শুরু করে সমস্ত কিছু, আর অর্জুন তো সেখানে বলতেও যায় না, ওদের ইনভাইটেডও হয় না। ব্যাড লাক অর্জুন।
আমরা কালকে একটা কনফারেন্স করেছি, the title of the conference is rational treatment of COVID. We dissected all this. It was beautiful. I will give the link, YouTube link in here.
I have seen the whole YouTube, and Ornalokda, oh God, he's so fantastic. He's just out of the world. And you can listen to him for hours. I'll ask you to watch him talking. When it was very unfortunate, the moderator had to stop it. But I was thinking that if I be moderator, I'll not help everybody stop and just ask him to talk. It was so good. It was so good. So good.
His paper is coming up next week, and he talks sense. He talks because he has seen the most.
Absolutely.
He has seen the most. He's seen about 60 mucors per day, so he knows better than any of us.
He's authority. He's authority.
So hopefully then you can help me next time to get him. Yes, definitely. I will try to arrange more people to come and listen to him. Definitely. So there are some questions to Dr. Dashgupta about the toothbrush again. Someone is still asking about the toothbrush. If you can repeat one more time.
If a person has COVID and the virus does live in the toothbrush, and the recommendation is throw it away after you had COVID.
Yeah, that's it. I think that is a simple thing that they can follow. And someone is also asking a question about 1-day fever and diarrhea. Is it also do you think this is a COVID symptom? 1-day fever and diarrhea?
Yes, can be. get tested.
I think in India, it's more likely to be infective due to any other reason rather than COVID. So you have to keep, although diarrhea can be a symptom of COVID.
Yeah, I think there's the best advice that we can give from the all over whatever we heard today, that whatever the symptoms is, so if you can take everything as COVID at the moment and go and speak to a doctor.
Other than pregnancy and fracture, everything else can be.
No,
and
actually, I want to make one observations from getting hold on the vaccine, that it is like arranged marriage. Initially, you said no, and then when you said one, you could not get one. And when you are married to somebody, you always thought the other one is better. Okay, it's happening with the vaccine. So this is interesting.
Okay, and there is one general advice for everyone in the team. So people are distributing their prescription in the social media and trying to get advice from other people. So I will definitely try to just tell them that try not to provide your prescription in social media and with their reports, because you will not get a proper advice. You will never get a proper advice like that. It's better always to speak to a doctor, always. Because I have seen so many other volunteer teams that they are trying to get all the prescriptions and asking people that, okay, what I can do. So some people are letting them that, oh, this is a severe case, this is a mild case, this is moderate, but how much people know? So I think it's the best advice not to get delayed and get a proper advice from your doctors only. Is there anything, Debaroti?
I can't see any other questions unless anyone have.
Can I just say something, please?
Yes, sir.
Before we finish, I think I just wanted to say thank you to both of you. I think both of you, Debaroti, and you have done a wonderful job. I think the amount of time both of you spend in trying to help people I think it's really commendable. I think really.
Oh, thank you, sir. Thank you so much. Thank you so much, because this was like a single-handed group that I started last 3 weeks back, because my parents were really affected with COVID and I had no help from outside. So staying in UK or abroad and helping parents is not an easy job, to be honest.
No, but
and I think
Debaroti
has also gone
thank
through
you very much. You are doing a wonderful job.
Thank you. So we have just done this platform to bring everyone close together so that we can help each other. So my group is doing really well, it's just really doing a good job in finding ambulances to bed, to bloods, to everything at the moment. And we have got doctors for teleconsultation, proper doctors, and not a two-pata prescriptions, not like that. Definitely not like that. So I think everyone should appreciate their effort at the moment, and all the medics, those who are helping us at the back. We have also started some one-to-one free physiotherapy WhatsApp sessions with patients. So just to give them a lung physiotherapy, I know how important is that in the post-COVID ITU patients and those who are already recovering from COVID. So if people are interested to join me, then I will give my email ID and my number. Debaroti will provide it in the chat. So if anyone who wants to refer and come, it's a free session for 15 minutes. The physiotherapists are from the hospitals, from RNT and other places. So they will definitely show you what to do, and in the Indian time. So please cooperate with them. And I think that will be a useful one.
One thing, Smita, one thing I request you to do in near future, webinar on the mental health.
Oh, yes.
It is going to be very, very significant, I'm telling you.
Yes.
Because
I think
it is affecting kids.
That in
it
mind.
Is affecting the housing.
I think,
yes, I think we have kept that in mind, mental health and COVID. And with some blood tests that people are, some doctors are advising some blood tests like D-dimer, IL-6 and CRP, how important they are in the initial stage of the COVID, or they have to do those blood tests. So I may ask some doctors to concentrate on this and just let the group know that how important. Maybe we will do it in the next session, maybe next week. But I will try to.
Sumita, one thing.
Yeah, I will try to invite. Yes, sir.
Like Sudipta has said about the mental health, I think that is a part of, because I'm quite involved in trying to do this in this area at the moment, is the long COVID symptoms. That mental health obviously is part of the long COVID. And by calculation, almost 10% of people who have COVID ends up with long COVID. One of this is anxiety, depression, and other things. Now, if you consider the percent of people who are getting COVID in India, and the lack of understanding of the long COVID symptoms, this is going to be the next huge pandemic unless it is addressed early. Because there is a lack of understanding how much disability COVID can cause long term.
Yes, yes, I agree.
Arjun, can I ask you something?
Sure.
Can you hear me? Yes. I was thinking to form a group for the kids, and it will be called Kids for the Kids. That means that a group of kids around 10 to 16 or 17 that who can discuss with each other, and they can moderate, and they can talk to some personality, and so that during this lockdown and COVID pandemic, when the schools are off, they can interact with each other. So I'm just floating this idea to you because you are actually quite involved in the theater segment and other segment. So whether that is possible, we can do something together. There'll be somebody supervising, definitely senior, but it should be done by the kids who will help each other. Because sometimes what I find, they just talking because it's their time. Now they speak to each other, they giggle, they chat, they share their private moment, they're going through the puberty, they cannot do these things. So it is going to have a significant effect on all of them. So if suppose somebody comes and tell how they achieve success, etc., among a closed and knit group of kids, because you have got a kid, I've got a kid, just think about it and find out whether it's possible or not. Just put the idea.
I think it's a brilliant idea. I think it's a brilliant idea. Let me think about it, and let's start first, and then we will formulate this. Yes.
Yeah, we will do that. We will do that. This is a very interesting topic about mental health and COVID. Okay, is there anything, Devaroti, to understand or to ask? Anything
Sorry,
from anyone?
I think it's really late in India, so I think
Yes,
we should
yes.
let the doctors.
Yeah, but it's a great platform. It's a great platform. Thank you everyone for coming. And it's within a very short notice, and I appreciate everyone's help.
Thank you very much, and thanks to the doctors for their invaluable
thank you so
insights
much.
and time. And one last thing, if you've got any further question, I've given a phone number and an email ID in the chat. Please feel free to ping in that. And if you need the recording of this session, we are happy to give away, but only if you ask for it. It's a long recording, so if you ask for it, we are happy to do that. Again, thank you very much for your time, and have a great day and great night.
Thank you very much. Thank you. Good night.
Thank you.
Good night.
Bye-bye.
Thank you. Bye.